Vermont's healthcare system consistently ranks among the best in the nation. However, the state remains one of the most expensive, and patients face severe shortages of specialists. This presentation introduces my two-part action plan, which aims to bridge the gap between a system that performs well on paper and one that delivers equitable care in practice. The average wait time to see a specialist in Vermont is 61 days, positioning the state severely behind the national average of 26 days. If someone were to face a serious medical issue requiring immediate specialist care, they would have no choice but to wait or to seek health care in another state hours away. Additionally, in 2025, average marketplace premiums were more than 140% higher than the national average. Because of this, underfunded community health centers are struggling to afford the cost of health insurance for their employees. Comparatively speaking, Vermont's healthcare costs are significantly more expensive than those of peer states like New Hampshire and Massachusetts. The University of Vermont Medical Center is by far the most significant healthcare provider in Vermont. It has a monopoly in the state because it's the largest provider with essentially zero competition. With inelastic demand, there are very few limits on prices from the market, allowing them to charge higher prices compared to states with competition amongst healthcare providers. It is challenging to have accessible healthcare in Vermont, as it is the most rural state. However, consistent healthcare is especially imperative because Vermont has one of the oldest populations in the United States, with 22.2% of residents over 65, many of whom require frequent medical care but struggle with mobility and transportation barriers. The state sees healthcare costs as an issue, and the Green Mountain Care Board ordered UVM to reduce commercial prices by 1% for 2025, finding their proposed prices higher than necessary after privately contracting the Oliver Wyman firm. In response to this unprecedented order, the UVM Health Network announced cuts to a range of patient services and clinic consolidations. However, this was a misguided effort. Instead, they should focus on keeping community health centers open. My solution to keeping these health centers open requires the support of healthcare workers who should organize with the Vermont Medical Society to apply for HRSA grant money to cover the costs of insuring health center employees in Vermont. Later, Vermont should fund telehealth expansion at health centers to assist in the specialist shortage. Members of the Vermont Medical Society at the State House would be tasked to propose this by testifying before the House Healthcare Committee and the Senate Health and Welfare Committee during the legislative session. And the second part of my action plan includes advocacy for Bill H721, for which the Vermont House has given preliminary approval for. The bill aims to expand access to Medicaid for young people and pregnant individuals and increase income limits for Medicare savings programs for older Vermonters. It also directs a study on a potential broader Medicaid expansion. Vermont advocacy organizations like the Vermont Workers Center, VCIL, and AARP Vermont must advocate for its passage by signing on as stakeholders and delivering testimony during public hearings in the House committees. This two-part plan focuses on preventative care, decreasing hospital costs while making health care more accessible. Thank you.